Hello, Klimek Review family. It's Dr. Sharon with Klimek Reviews. I'm so glad to see you today. I hope you are having a great day. Today, we're going to continue our walk through the Blue Book while doing Nurse and the Law with the Blue Book that Mark Klimek wrote himself. And I don't make any money from it. So if I tell you to go buy it, I feel like ethically I can do that because I'm not making any money off it. So you can buy it on Amazon. Okay. So we're doing pages 11, 12, and 13. It's Nurse and the Law 1 and 2. First, we're going to go through definitions. And Mark has said, for as long as I've known him, he has said vocabulary is the number one reason people fail NCLEX. So first I'm going to go through the vocabulary, which is what Nurse and the Law 1 is. And then I'm going to go talk about some scenarios and how to answer the questions, which is what Nurse and the Law 2 is. Okay, so first we're going to talk about assault and battery. And, this isn't how I use these words necessarily in my own vernacular, but assault is actually the verbal threat of doing something without a person's permission, whereas battery is actually touching them and doing something without their permission. So that's not always how I think of those words. So assault is the verbal threat. So if you walk in the room and you're taking care of a psych patient, he says, yeah, I don't want to take my psych meds. And you say, well, if you don't take them, I'm going to have to get a shot or I'm going to get an IV and put it in your IV. Y'all, that's assault. That's a verbal threat right there. So don't do that. Okay. So, and then battery is actually following through on that, doing something without their consent. And so if you say, well, if you don't take your med, I'm going to give it to you in the IV. And they go, I'm not taking my med. And so you go and get the IV med and you give it to them in the IV and they're screaming, help me, help me, help me. Y'all, you could be charged with assault and battery right there. Okay. So don't do it. You might say, well, we have patients, we give them medications against their will. We do, but we have a court order for it. Or we have somebody who is their legal healthcare power of attorney who gives us permission to do it, right? So there has to be a legal reason why we're able to do things against people's personal will. So don't be doing those things and don't threaten to do them, y'all. Don't threaten to do those things. I don't care what they're saying. Do not threaten them to do something against their will. They don't lose their civil rights just because they come in the hospital. Now, common law is when a precedent has been set in the court system. So for those of you who don't necessarily understand the legal system in the US, we have two sort of levels. We have the federal level, which is the United States country level. That's called the federal level, where we have a lot of laws. And then we have the state level. And the United States came together as a group of states, and each state said, look, we want to be able to govern ourselves, but for safety and security reasons, we wanted to band together to have an army and a way to protect ourselves. So the intention was at the federal level, the federal government wasn't intended to have a ton of control over people's everyday lives. We originally paid taxes and so forth to the federal government to protect us against foreign invasion. And then the state level was intended to really write all the laws to govern people's daily lives. Now, the federal level has greatly expanded and so forth. We all know that. I'm not going to get into all the politics of that. But what I'm saying is, for those of you who are like, I don't understand the United States and how it works, that's how it originally was set up. And now, and nursing is governed at the state level. It's not governed at the federal level. So states write laws that govern nursing. And so if there's the Nurse Practice Act, it's called the Nurse Practice Act. Each state, California, Ohio, New Mexico, Florida, Texas, Michigan, Massachusetts, they each have their own Nurse Practice Act. There's legislation, which is the laws in each state that say this is what a nurse is allowed to do. But let's say something happens to a nurse, or the nurse does something to someone else, and someone brings a lawsuit. And there's no actual law that governs how this should be handled. And so the judge has to make a decision about how to handle this problem. And so let's say we have problem X, and we have Judge A rules a certain way on problem X. So then when problem X comes up again with another group of people, and this same problem is brought before Judge B. It's a different group of people, but same problem now is Group B. Judge B looks to see how Judge A ruled. so that they can treat people equally. And then the same problem comes up with another group of people that goes before Judge C. Judge C looks at Judge A and B and says, well, how did they rule? I want to treat people fairly. Have you ever heard of the phrase justice is blind? If you've ever seen the pictures of the woman standing there with the scales and she has the blindfold over her eyes, that says justice is blind. In other words, we treat everybody fairly. I'm not saying that's what happens. I'm saying that's what's supposed to happen, right? That's what justice means, fairness. And so people are supposed to be treated the same. And that's why the judges, Judge C looks to see how Judge A and B ruled. And even though there's no actual written law by, say, the legislation of that state, the judges want to treat people the same. They want to treat people fairly or with justice. And so once these rulings have been made, say 3, 4, 5 times, it becomes common law. And they say, look, we've been ruling the same way for many, many years, and we're going to continue to rule that way because that's fair. Now, the legislature, the state legislature, the federal government can say that's not fair at all. We're going to make a law that says you can't rule that way. And so that's fine. They can make a law that says you cannot rule that way. But until the legislature says that's not right, you cannot rule that way, then the judges are going to keep ruling that way. So common law is a precedent that's set by judges over time that can be overruled by legislative law being written, but generally speaking is kept as the precedent. So that's what common law is. Okay, malpractice. Malpractice. And I have a screen over here, so I want to read it to you what I have written down here. Malpractice refers to improper, illegal, or negligent professional activity or treatment. And it's usually used with healthcare professionals. Not always. Malpractice can be used in other areas, but it's often used in healthcare professionals. So it is illegal, improper, negligent. So malpractice is sort of the umbrella term. And then you have under it illegal. So, if I'm stealing medications, that's illegal. It's illegal for me to hit my patients. That's malpractice. That's illegal, but also negligent. Negligence is when I fail to do something that the average nurse or the typical nurse would be expected to know to do. And negligence is often the basis for lawsuits, right? So the nurse should have picked up that I was bleeding out, or the nurse should have picked up that my wife was bleeding out after she delivered the baby because her blood pressure was going down and she was going through pad after pad after pad and she was pale. And she ended up dying from postpartum hemorrhage. And the nurse should have known enough to pick up from that. And that could be considered negligence, which is also malpractice. Which is why, y'all, if you go and watch the prioritization videos that I've done, you're going to see that many of the right answers are the unexpected finding. So what are you most concerned about? The unexpected finding or the changing assessment. And that's because they want to know if you at least know enough to pick up on a changing assessment or an unexpected finding. If a person's admitted with heart failure and they have crackles in their lungs, okay, fine. That's fine. But if they had an O2 set that was 95% and now it's 90%, that's a problem, right? Because that's a changing assessment. That's an unexpected finding. The crackles in their lungs may not be unexpected, but the drop in O2 set is. And so they want to know, do you know enough to pick that up? So keep that in mind, because that's why the unexpected finding or the changing assessment is so often the correct answer, because that's the one that you're most concerned about. They want to know that you at least are not going to be negligent. You don't have to know everything. You do not have to know everything, but you have to be able to identify a changing assessment or an unexpected finding. So you can go back and review those. So malpractice is the umbrella term. Negligence is underneath it. Okay, malpractice is also illegal behavior, improper behavior, and so forth, but negligence falls underneath malpractice. False imprisonment is when you, let's see, it says here, unjustifiable restraint or prevention of the movement of a person without proper consent. So that doesn't mean it's illegal to restrain someone. There is justifiable reasons for restraining someone, but when there's no reason for it and you restrain them, that's false imprisonment. And then a misdemeanor is a wrong of less seriousness than a felony, and a felony is a wrong of serious nature. So they may not ask you what a felony is or what a misdemeanor is, but if you are asked that, you want to look for the less serious uh, activity as the misdemeanor or the most serious activity for the felony. And then I already talked about negligence, invasion of privacy, a wrongful act that violates the right of a person to be left alone. Y'all, people have the right to be left alone. So don't just, that's why we knock before we walk in the room. That's why we don't just barge in the bathroom when someone's going to the bathroom. Like, that's invasion of privacy. You can't look through their purse. You can't look through the things that they bring with them. That's why even if you suspect that there's drugs in their purse, you can't just be looking through it. You have to call the security officers who will follow whatever the protocol is. And even often the security officers won't even look through their purse because that's invasion of privacy. We don't have warrants or rights to do that. So you have to be very, very careful about what you do. So if they say you suspect a person has drugs in their purse, do not choose the answer that says look through their purse to find it. That's not the right answer. You can call the police if you think they do, but you are not going to be looking through their purse. Then there's two words, liable and libel. Liable, Liable, means the person is accountable or responsible. So think of the word responsible when you think liable. So the nurse is liable for their actions. They are responsible for their actions. Now, we tend to use the word responsible more often, but liable, I mean, you could use that interchangeably with responsibility. I'm responsible, I'm liable. So think about that as you do things and think, okay, am I willing to be held accountable for what I'm doing right now? Sometimes things seem like a good idea until we say, am I willing to be held accountable for what I'm doing right now? And then libel, Libel, is a written untruthful statement about a person that subjects him or her to ridicule or contempt. So libel, Libel, is a written untrue statement, whereas slander is a verbal untrue statement that causes them harm or ridicule. So those are the legal terms, libel and slander. Libel is written, slander is verbal. All right, let's go ahead and do some questions. All right. Hello, Klimek Review family. As most of you know, this YouTube channel is a part of the Klimek Review NCLEX review business that's run by Mark Klimek. And the YouTube channel is an opportunity for you to see what we do and how we help you pass NCLEX without any cost to you. But we also offer some things that you can pay for that are really worth paying for. And I want to tell you a little bit about those things. So if you go to klimekreviews.com, you will see when you first get there, it'll tell you about Klimek Connect. And Klimek Connect is actually a free community that you can join. And Mark Klimek does participate in the Klimek Connect community. So you can join that. You can actually see some videos from Mark Klimek and you can have some interaction with him. You can ask him questions and so forth and make recommendations that you would like to see. If you go ahead and scroll down, you actually will see some of the other products that we provide. You can see our world famous NCLEX review that Mark Klimek does, and you can purchase it online on demand. And you can have access to it for a minimum of 3 months. And then I think you can purchase it for a little bit longer. Mark Klimek actually teaches these lectures. They are on demand, so they're recorded, but they're really phenomenal. You're going to learn so much by taking this NCLEX review. Mark developed it specifically for people who struggle to pass. So especially if you're struggling to pass, I recommend it. And then even if you're not struggling to pass or you haven't taken the NCLEX yet, we do recommend, or I recommend, the tutoring. I teach one of the tutoring sessions and it's live stream, so you can actually talk to me, see what's going on, ask me questions personally. Mark Klimek teaches 2 of those live streams, so you can actually meet him and talk to him. And then Dr. Pete or Trevor teaches the other one. And there are obviously there's 4. I just told you there's 4. And they are also recorded so that if you can't attend the live stream, you can watch them in recording. Or if you attend the live stream and want to watch them again, you can do that as well. So these are some of the products that we offer. And I do recommend looking into them. There's some really terrific products. Even if you don't do those, we're so glad you're part of the Klimek Review family on YouTube. And we do want to support you in passing NCLEX. That's our goal across the board, is supporting you in passing your NCLEX and becoming nurses, because we really need nurses to provide excellent care. So we wish you all the best. as you prepare to take your NCLEX, and see you later as part of the family. Bye. Client perceives that the nurse intends to do a procedure without consent or justification. The nurse could be charged with what? All right, they intend to do it. They haven't actually done it yet. So that's assault. It's the threat of doing something without consent. And then a nurse threatens to give a patient an injection if they do not take their oral medication. It's the same thing. It's just a same answer, worded differently. I just wanted to show you how it can be worded differently. And this is why you do not threaten people to give them their medication through their IV if they don't take their oral medication. Don't do it. If they're refusing to take the medication, you document it. You can talk with them, try to teach them why the medication is important. But y'all, if they refuse to take it, do not be verbally assaulting them, and certainly don't give it to them without their permission. The nurse willfully touches a client in any manner that is wrong in some way. The nurse could be charged with what? That's battery. And then a nurse administers an injection to a patient without their consent. This can be categorized again as battery. Y'all, don't be doing that. Okay, that is illegal. I don't know if it's illegal in all other countries, but it's definitely illegal in the US and Canada. So don't do it. The nurse walks into a room where the patient is restrained by 2-point restraints. What is the best response? Check capillary refill. Well, that's a good idea. Inform the nurse manager that a patient may be falsely imprisoned. That's a bit of an overreaction. Release the restraints. Absolutely not. Confront the nurse assigned to care for the client. No, y'all, don't make this into more than it is. We walk into rooms all the time where people are restrained. It's not false imprisonment. Check the capillary refill. Make sure they're doing okay. If you have questions, I mean, if you're like, oh my word, I didn't know we had somebody restrained. Yeah, you can go out and ask, I guess, somebody, hey, we got somebody restrained? I didn't know that. What's going on in there? I mean, you can ask that question, but don't make it into more than it is. That's not how we act in the hospital, right? If somebody's restrained, we go, okay, they're restrained. They're not my patient, so maybe I don't know why, but that's fine. I can check on them, make sure they're okay. 6, a nurse applies restraints to a patient without a physician's order and without justification. What would this be considered? Now you might say, well, it could be battery or false imprisonment, but battery is touching them without their consent or doing something to them without their consent, whereas restraining them, specifically restraining them, is false imprisonment. So pick the better answer. 7, the healthcare provider asked the nurse to get the informed consent, but the nurse was not in the room when they discussed the risks and benefits of the procedure. What's the nurse's best response? We don't have to be in the room when they do that. That's the physician's responsibility. Okay. They say, can you get the consent? I say, sure. That's what I say, y'all. That's what I say. Sure, I'll get the consent. Inform the healthcare provider that the RN cannot witness consent. No, absolutely not. Ask the healthcare provider if they reviewed the risks and benefits of the procedure with the client. You might go, well, that's a good answer. Y'all, but we don't do that. If the doctor says, can you get the consent? I don't question the doctor. Did you really cover all the risks and benefits? We don't do that. They're not accountable to us. We don't question them that way, like that. Okay. I mean, if they're doing something illegal or harmful, we can confront them, but they're not doing anything illegal or harmful. They're doing something within their scope of practice, and they're asking us to do something within our scope of practice. So do it. Obtain the informed consent. Yes. Ask the client to teach back what the healthcare provider taught them. Absolutely not. This is not a nursing teach back. We don't know what the risks and benefits are. We don't even know necessarily what the doctor told the patient. We just say, are you willing to sign the consent? And they say yes or no. If they say no, we call the doc and say, hey, they refuse to sign. If they say yes, we go, good. We witness their consent. We witness their signature. We put it in the chart. All right. Common law in nursing primarily refers to what? Laws created by legislation? No. Administrative rules and regulations? No. Guidelines established by professional organizations? No. Court decisions that establish precedents? Yes, that is the correct answer. A nurse fails to properly monitor a patient post-surgery, leading to the patient's condition worsening. This is an example of what? Negligence, assault, malpractice, or liable. So it's not a great question because there's sort of 2 right answers here, but I actually kept it on my list of questions because I wanted to teach you a principle. The principle that I want to teach you is the umbrella principle. So if there's 2 answers that both are right, look to see if one of them encompasses the other answer. So like if I say, well, I need to get their vital sign. Well, let's say you say to yourself, I need to get their heart rate. And so it says, get their vital signs, get their heart rate, get their blood pressure. Those are three different answers. And you go, well, heart rate and vital signs are the same thing. So which should I pick? Go with the umbrella answer, the one that encompasses the other answer. So I would pick check vital signs. So remember I told you malpractice is the umbrella principle over assault. Over negligence, over assault, over any illegal activity or improper activity. So I'm going to pick malpractice because that's the umbrella principle. Which of the following actions by a healthcare professional would be classified as a felony? So remember, felonies are serious, misdemeanors are less serious. So failing to document a patient's medication, that's illegal. I guess it's outside the bounds of what we're supposed to do, but it's not necessarily serious, harming the patient. Abusing a patient physically, well, that's pretty serious. Accidentally omitting a dose of medication, well, it's an accident. So, it's not great, but it's an accident. Talk loudly in the hospital corridor, that's nothing. So I'm going to pick the worst one here, the worst action, which is abusing a patient physically. Negligence in nursing practice is best described as what? A nurse failing to perform an action that reasonably prudent nurse would perform. Absolutely. That's a very good definition of negligence. A nurse intentionally causing harm to a patient. That's definitely a misdemeanor, but that's not negligence. A nurse performing a procedure without proper consent, that's battery. A nurse threatening a patient with physical harm, that's assault. So negligence is A. 12, a nurse is found liable in a malpractice lawsuit. Remember, liable means I'm responsible. So the nurse is guilty. No, that's not what it means. It means I'm responsible. The nurse is responsible for damages due to negligence. Okay, I'm looking for the word that says responsible. I like it. They're responsible for damages due to negligence. That's actually one example of liability. So it's not the only example of liability, but it is an example. The nurse has violated hospital policy. They may have to take responsibility for that, but that's not specifically the definition of liability. The nurse must serve jail time. No. So I like the answer that says specifically the nurse is responsible for something. So that's a good answer. 13, the nurse writes a false and damaging statement about a colleague in a patient's chart. So remember, libel, not liable, libel is written untrue statements. Slander is verbal untrue statements. So we're going to go with libel. And a nurse verbally spreads false information about a colleague to other staff members. So that's slander. All right. Okie doke. Well, I hope that helped. Do you know how long it took me to make this video? I had to stop and start it so many times because I was like, wait a minute, is that assault or battery? Wait a minute, is that libel or slander? Wait a minute, is that misdemeanor or negligence? Like I had to keep stopping and starting. And I made an entire video and I had to delete it because the microphone wasn't working. Not that you care about any of that. So thank you for watching all the way to the end, y'all. Sign up for a Klimek review at KlimekReviews.com. Sign up for our tutoring if you would like some tutoring. And I hope you have a great rest of your day.